Thank you so much for taking the time to talk to me today. As you know, I'm actually 22 weeks pregnant today, and we're expecting our second child, so we're very excited. With the pandemic going on, the biggest question is this COVID-19 vaccine. One of the things that my OB discussed with me when I first, announced that I was pregnant and I went for my first checkup was let's see what the data shows. Let's see what comes out, the information that's coming out. And I was like, okay, so because I wasn't comfortable yet, there wasn't enough data research to help me make my decision. And I do work as a surgical physician assistant, so I'm in the hospital. So that's another thing, like I'm more in a high risk environment. So it made me kind of like, well, I should get it. Shouldn't I get it? I wear all my N95 for all my cases. Like I know I protect myself. What can you tell us about the COVID-19 vaccine with effects on pregnant women and also women who might be lactating, and also how it affects their babies?
Wonderful, Kristen. First of all, congratulations to you.
Thank you.
You are doing a great service to the people by continuing to be a healthcare provider on the front lines, even during this pandemic. So we're all thanks to you for your service. We're indebted to you because it's brave souls like yourself and that actually are needed. Now, getting back to the issue of vaccines and pregnancy, especially with regards to COVID. It's important and it's really a remarkable feat that we've been able to develop a vaccine against this novel coronavirus within a matter of months. And not just we in the United States, but there are a number of these vaccines that have been developed across the globe. And there's an ongoing active effort to vaccinate people. Right now, it's literally the amount of needles that are going into the arms is translating into life saved every hour, every minute of the day. We know from the safety and efficacy data of the COVID-19 vaccine that they were found to be pretty effective against general population and relatively safe. What we don't know yet is what that clinical trial data would show for pregnant people. So same thing applies to lactating people. So one of the things we do is there are certain markers to make sure that we have some early data. We have animal studies. We have studies of pregnant people that were included in the initial trials unintentionally. And then we have post-vaccination data that is being reported right now of people getting vaccinated who may also be pregnant. And through all of the data sets that are coming out, we don't seem to have really a concern at this time for this particular vaccine in pregnancy or in lactation. It's a good news kind of thing, but it's very important at the same time that if you do have questions, because we have to understand that some people, there could be allergies, that you could have allergic reaction to the vaccine. And for others, one of the side effects, especially after the second dose, is fever. Now, not the vaccine, but fever itself is not a good thing for the developing fetus. So therefore, we recommend using something like acetaminophen or Tylenol if you get vaccine and you have fever, so that your body temperature doesn't rise so much above that it could potentially hurt the baby. And the fever is for any reason, not just post-vaccine. So, and if you have questions, it's very important to talk to your physician or provider about the use of vaccine during this time. Now, having said that, I think every individual has to make a decision, because for someone who's a healthcare provider like yourself and is pretty much involved in a risky sort of procedure every time you're seeing patients, the risk variant for you is very different in pregnancy than someone who's staying home. We know that getting COVID during pregnancy increases the chance of hospitalization, ICU admission, being on a ventilator, and dying. So we know that there are significant risks of getting COVID infection while you're pregnant. So it's really critical that you are able to balance your risk with the safety and efficacy profile of the vaccine.
So going back to women, like I mentioned, the nurses on the floor, some of them, and also some of my coworkers have daughters who just got married and they don't want to get the vaccine because they're concerned about the risk of infertility. And I know that back in February, there was an article by the Washington Post that talked about the myths or the disinformation that they're providing about the COVID-19 vaccine that was on social media. So what is there for a woman who's trying to consider conceiving? What do we need to know so that they can be more educated and more aware that this vaccine is safe for them?
Yeah, so one of the very important pieces that happens during any time we're talking about vaccine is all the myths and the false information that comes up on social media and other places. So it's very, very important for us to make sure that we're going to the right sources and getting the right information, the most accurate scientific information in order to make good decisions. So sites like CDC, March of Dimes, others are places where you can actually get real factual information. So there's all kinds of crazy or scary theories out there. What's important for us when we're making a decision that impacts, our life in terms of the risk of COVID and the dying from COVID is so critical, is to get good data, good science, and then make an informed decision. And if you've got to talk to your provider, then talk to your provider about it and make a decision that helps protect not just you, but also your baby, other children, your family, your neighbors. So it's a very important thing. Your decision has an impact in this case, not just upon you, but on so many other people.
You're right. People need to get informed information. They need to do their research. They need to get the valuable sources to get that information. So the concern for me, which today, like I had my checkup and he's like, well, are you vaccinated? I was like, well, we discussed this. He's like, well, I think now, there's a little more information out there. So I think, I know I'm also further along too, but still he kind of is like, oh, I think it's safe, to get it. And so I kind of felt like, all right, talking to him, but I'm like, tell me what to do. Cause I kind of felt like, it's a little conflicting. And he said, obviously it's my final decision, but at the same time, I just felt like today I left there thinking, oh, what should I do? So I'm very glad we're talking today. One of the things that it comes up, why weren't pregnant women or women who are lactating included in the initial trials?
Yeah, so think about this way. When we have a novel vaccine, and I want to talk a little bit about the vaccine itself in a second, but when you have a novel vaccine, you want to make sure for the first time you actually try it out on healthy adults. You don't want to take an experiment vaccine and then try on little children or pregnant people. You actually want to start first by trying it on healthy people to see if there's consequences or bad side effects. And we haven't found any severe bad side effects. That increases the confidence in the vaccine. So, literally 100 million people in this country have gotten the vaccine so far. And because the safety data coming back is so well, it increases our confidence in the vaccine and in our ability to then look at other populations. That includes pregnant people, that includes lactating people, that includes children as well. And then you sort of start to build up that little group of people that can actually benefit. Now, having said that, there were some animal studies done that did not show any red flags for the vaccine. There also, if you look at the vaccine itself, it does not have a live virus. It also does not have a DNA in the vaccine. So what that means is this mRNA platform to transfer the antigen. What it does is it cannot go into a cell's DNA. And our human cells really attack that platform and destroy it very quickly. So if you look at it from a scientific standpoint, it does not have the ability, the vaccine does, to actually impact the DNA of cells. And we're talking about the growth of the baby at this time, the fetus. So therefore, we have quite a high level of confidence that this vaccine should be and would be safe in pregnancy and in lactating people. Yet it's still important to get that scientific data, rigorous scientific data. But as time goes on, there are now being trials planned and provided to look at pregnant people. But at the same time, when you do get your vaccine, you're going to be encouraged to put your information into an app called vSafe. It's CDC's app, which you can enter your information and it'll actually trigger you to put your side effects every day for a few days. So this is how we're monitoring the side effect profile of the vaccine, and we're seeing a lot of encouraging results.
Oh, that's wonderful. I didn't realize they had that app to follow, like track everybody. So
Yes.
that's really good.
It's voluntary, but if you were to, I put my information in and it sent me a text every day to put in my information if I had fever, if I had a sore arm, if I had other symptoms. And that way we can all be part of the solution as communities and as a nation to help figure out how, what are the side effect profile of this vaccine.
Right. Okay. So I know, how is the March of Dimes supporting the COVID-19 vaccine research? Are they part of playing a role in the research process?
Absolutely. One of the things we've done during this time is to utilize our COVID fund to support research that is looking at the transfer of antibodies in people who may have COVID across placenta, across breast milk. And we're learning that. We've funded a study at University of Pennsylvania and another study at Mass General Hospital in Boston to look at that work that is ongoing. In addition, we've actually, turned our programs, several first service programs, into virtual programs in terms of care at neonatal ICUs, supported pregnancy care, and other programs. We've been able to distribute blood pressure cuffs, breast pumps, as well as some other aspects to help people on the ground dealing with COVID. So there's a lot of work that has happened across March Dimes to help people in need, especially during the pandemic.
That's wonderful. Like, that's incredible what you guys are doing, how you reach out to the communities and everything. That's great. What can legislators do to help support pregnant women and breastfeeding women during this COVID-19 pandemic?
Across the nation, a lot of people have lost their jobs. A lot of people are struggling to get access to good insurance. A lot of people still need help with understanding whether it's the vaccine or whether it's a lot of other aspects, which is part of pregnancy and having that education. We still have institutional racism that goes on across our nation, and nowhere is it more profound than in the area of when a woman is about to have a child. We know that that is a terrible outcome, because if someone dies or has complications because they're of a certain skin color. So I think lawmakers can do a lot, both at a federal level and state level, to make it easier for people to have access to health insurance, make it easier for them to be able to get the support they need around themselves during pregnancy, and make sure that they don't have to worry about getting their medications or vaccines or their trips, whether they're virtual or in person. So it's a lot of things that is important, but not always there. And in time of COVID, in time of a pandemic, there are more and more people who are quarantined, isolated. There's also mental health aspects that we know impacts pregnancy outcomes. So having access to good coverage of health insurance, having the wherewithal and the resources to be able to visit the doctor's office, whether it's transportation, whether it's housing, and making sure that implicit bias does not play a role in discharge of our duties as healthcare practitioners is so critical, and so much more that policymakers can help us make sure that there's equity and access in the healthcare field.
Great. No, that's very important, especially for those who need it the most and who are, like you said, misrepresented. So it's very important that they have that access and that support. It comes down to, making that informed decision and talking to your provider and getting that information. Because again, like I mentioned before, like for me, I know I'm 22 weeks. I know the baby's still developing. So I guess it's more of like for me, it would be more of a personal decision to wait at least maybe to the third trimester, where I know that the baby's more fully developed. But at the same time, I'm like, is that silly to wait that long? Like, I don't know. I mean, I know, again, ultimately, talking to the provider, but I don't know if there's any information. I don't know. I don't know.
Yeah, no, I think, Kristen, I think your hesitancy for vaccine is so emblematic of so many people across the country. And so there's nothing wrong with it. It's okay to be hesitant. It really is. I think you have to, just like we do for everything in life, right? Whether it's purchasing a piece of equipment, your home, furniture, or having a baby, you have to make a calculated decision. And I think when you approach it that way, it gets it a little simpler. In that decision making, you have to look at the risk to you. So it's not just the patients that you're in the operating room for, but it's also the act of getting out of your home, driving to the hospital, walking through the doors, across the halls, interacting with other people whom you will never know if they have or not have COVID. So all of those incidental transmission that occurs in any place and area where people are gathered, that's a risk. Same way at home, if you have a child that maybe goes to daycare or not, could also have COVID, which they may not manifest as infection, or a spouse. So on one hand, you have clearly a risk factors that we know and we learn in pregnancy, the risk of being hospitalized, the risk of being in ICU, being on a ventilator, and being dying are tremendously more, much more than people who are not pregnant and they get COVID. Now, on the other hand, is a vaccine. Of course, the vaccine, all the indications minus actual clinical trial shows it's relatively safe. And we may not get that clinical trial results for several weeks to come. At the same time, we know it's highly effective, especially some of the numbers that is shown for severe illness like hospitalization and deaths is literally extremely effective for that. But there could be potential allergic reactions that you have to worry about. You have to monitor the fever that may occur, especially after the second dose. Those are some of the risks still. And at the end of the day, then you have to make a decision. But also know that, most of the vaccines today out there, the two that we know of, are 2-dose vaccines. So taking 1 dose is not as effective. So it still takes about 2 weeks after the second dose. So if you look at one of the vaccines with Moderna, that's a total of 6 weeks. And with Pfizer, that's a total of 5 weeks. So when we're counting weeks like we do in pregnancy, those 5 and 6 weeks do matter in order to get protection. So you have to factor those in too, because you don't get the immunity right after you take the vaccine. It takes quite a bit of time to get that effectiveness in the system.
Right. So you still have to obviously follow safety protocols and I just keep doing what I'd be doing, right, to make sure I'm protected, safe. Because I feel like that sometimes some patients, not patients, but people who got the vaccine might think that, oh, I got the vaccine, I'm good now. But you're right. You have to build up the antibodies, right? Your immune system has to build it and prepare and fight.
Yes. And one of the very important things you just mentioned is, regardless of that vaccine, you still have to wear your mask, keep socially distant, not be around groups of people. So those hand washing, universal precautions, those are the things that have shown to be proven to be helpful. And those are things you're going to continue to do regardless of your vaccine status, at least for now that we know. So it's very important to keep those measures ongoing as well, Kristen.
Right, of course. No, thank you. I think I definitely feel like after talking with you, definitely feel more comfortable, like, because you're very informative with everything. I think I pretty much feel like, because again, the bottom line is like what I got from what you had mentioned to me, like, which kind of gives me a little more peace of mind, is that from what you said, that what you're seeing in terms of the sort of, I don't know if data is the right term, but what's coming out with the research that is starting to come out is that it does show that this vaccine is safe. It's the messenger RNA, not the DNA. So therefore, like, it won't affect the cells, which I think is one of the things, or like the myth that I feel like women who are trying, think or worried about infertility, they think that it's going to affect something down the line with their cells or their bodies, or even if they have if they're pregnant and it's going to affect the baby's DNA. But it shows that that's not the case, because it's not the type of vaccine that it is. So
Absolutely not.
it helps because I feel you explained that very well.
Yes. And we're glad to have this platform, mRNA. It's a unique platform, and it's a safe platform. At the same time, again, we used to have live attenuated viruses as vaccine. And there's no live virus in this vaccine either. So it's as safe as it can be. We have seen no signs of signals to say that there should be a concern for pregnant people. So at this point, we are seeing all the green lights, as we await the final results of those trials in pregnant and lactating people.